Hi, everyone. I'm Irene, the Development Director with the Know Your Lemons Foundation, and thank you for coming to Implementing the Global Breast Cancer Initiative, an international collaboration model to decrease the global breast cancer burden. So just to give a preview of our session agenda, first we're going to start by reviewing the World Health Organization's Global Breast Cancer Initiative pillars. And then we'll talk about how Know Your Lemons has the perfect educational tools and the pillar alignment. Next, we'll introduce the Know Your Lemons World Breast Alliance, how we measure our impact, and then we'll move on to our panel discussion so you can learn from organizations who are doing the work out in the field right now. And I'm going to turn it over to Corinne Ellsworth-Beaumont, the CEO of the Know Your Lemons Foundation.
Hello, everyone. Thank you so much for being here today. I just wanted to start off by sharing a little bit about my background. So my background is I am a graphic designer in the cancer space. How this started was I was starting my master's degree in graphic design when I lost my second grandmother to breast cancer. And it was at that point I realized I didn't know anything about breast health. I didn't know if I was at increased risk. I didn't know when I should be starting mammograms. I didn't know what a cancerous lump felt like. I didn't know how to do a self-exam. And so I started looking up this information, and there wasn't a single place that had the answer to all those very basic questions. And I went to a cancer library at a nationally recognized cancer treatment center, and I walked in my early 20s, and I said, "Hi, I want to learn more about breast cancer and understand my risk." And they said, "Well, we don't have anyone your age coming in here." So they handed me a bunch of handouts and leaflets and brochures, and they sent me to a number of websites. And I left that cancer center with a lot more questions than I had going in. And as a graphic designer, I was looking at all this literature, and I thought, this is boring. You know, it's really text heavy. There's very contrived images on a lot of these medical things. I mean, nobody says, I've got some spare time, so I'm going to sit down and read these medical leaflets. That's really going to, fill my cup. So I was looking at this as a graphic designer and thought, there needs to be a better way to communicate about this topic, because for me, it required 2 family members dying before I was willing to get engaged in this. This wasn't something I was taught about in school. Right? We talk about every part of the body in school except for breasts. And we know that breast cancer now is the most common cancer in the world. It impacts many people, it impacts many families. And there have been a number of things that have held us back from being able to discuss this. One of the main ones is breasts. The cancer's on the breast, right? That creates a taboo. There's embarrassment, which leads to censorship. Cancer, fearful, right? So you combine these 2 things, breasts that are associated with sex, and you've got cancer that's associated with fear and death. Breast cancer is sex death. That's a really hard topic to communicate when you're combining those 2 things together. So as a designer, I thought, how could I create something that would remove sex from the breasts and death from cancer? So I'll be showing this as we go through, but I want to start by looking at the WHO problem statement about why we need to have this global breast cancer initiative. So it's the most common cancer worldwide. It disproportionately affects individuals in low and middle income countries. And breast cancer 5-year survival rates in high income countries are quite high, and low-income countries quite low. So there's this definite health disparity. So the GBCI set the goal to reduce breast cancer mortality by 2.5% per year over a 20-year period would save 2.5 million lives. And so here are the pillars that have been set up for the implementation framework. So we've got Pillar 1, which is about health promotion for early detection. Pillar 2 is about ensuring that there's a timely diagnosis and screening where available. And then pillar number 3 is about breast cancer treatment and management. And the goal is that if we have 3 of these strong pillars, then we're going to be able to make a difference on mortality and cancer burden for breast cancer. And the thing that links all of these things together is communication. Wherever you have a failure in communication, you do not get to the next pillar. And communication can involve a lot of different things. It can be how the healthcare team is communicating to the patient. It could be what the patient understands themselves that leads them to the healthcare system. Maybe it's a navigator that's helping them understand how to access resources, those sorts of things. Communicating urgency for different scenarios, that sort of thing. So what we've done at Know Your Lemons, which is the organization that I created after doing a bunch of research on how to design for global audiences for breast cancer. And we've created these educational tools for every single pillar. And I'll be talking about each of these tools today as we go along. So this is why we're called Know Your Lemons. It's because we use lemons as a visual stand-in for breasts, which avoids the censorship issues that we face when we're talking about breast cancer. And it also requires very little text. If I didn't have that text up there saying what a cancerous lump often feels like, you would still know that information. And what happens is when we see these two round objects with a dot in the middle, our brain goes, okay, lemons don't normally sit on a couch, so there's something humanizing about this. And then we say, okay, well, what's human about this shape? And then we go, I know a human shape that looks like that, right? Breasts. And then when this is sliced open and we see that, we know that that means a lump. And then we remember the last time we felt a lemon pip or a lemon seed between our fingers, and we know exactly what that feels like. So without using any words, you can communicate breast cancer. That's really useful, especially in a global setting where not everybody can read, as well as not everybody has time to read, right? If you can have a leaflet that thoroughly explains something, but it takes 5 pages, it might as well not be printed because most people will not sit down to absorb that. But you know, a picture's worth 1,000 words, and if you do a picture right, you can communicate things very, very quickly. So that brings me to the main image that we're most known for, which is the one that displays the 12 signs of breast cancer. This image today is in over 40 languages and has been seen by our estimates 1.85 billion people around the world, and has been responsible for many people recognizing they had a symptom of breast cancer and being able to get diagnosed earlier. So we have goodies for everybody who comes here today. You can take home this picture with you. We have lots of different languages and postcards, so we'll leave a little time at the end of the session for you to come up and grab some things. So take the picture and then take things home with you. But our goal as an organization is to make sure that everybody can be able to see this image, because what a cheap way of improving early detection is, look at this picture. Okay, great. Now we're going to put a phone number on this for the local organization for you to be navigated into the system, right? So part of making sure it's accessible to everybody is making sure that it adjusts to different contexts. In some parts of the world, lemons are green. So we have a green campaign that we use in Africa and South America. And then we did some research. So this was work out of Nigeria, where we had Know Your Lemons classes and handed out the materials. And we found afterwards 96% said they felt more confident in being able to recognize a symptom of breast cancer compared to before coming to the class. 98% said that they would definitely report a change to their doctor. 92% said that they'd share the image with someone else. So think about the exponential learning there, that if you teach 10 people, that might end up educating 40, because it's such an easy image to share. So these were fridge magnets, and they have a phone number that says, notice a change, call this number. And that's for a navigation service to help them understand what they need to do about that symptom. We also did research in the Netherlands with breast cancer patients. And what we did is, before showing them this image, we asked them, how many of you had more than one symptom of breast cancer? And 11% reported having more than one symptom. Then we showed them this picture and then said, okay, which symptom or symptoms did you have? And then 44% reported having more than one symptom. What that tells us is that breast cancer patients themselves do not know all the symptoms of breast cancer they had at the time they were diagnosed. And if they didn't know them by the time the survey came around and they have a recurrence in between a scan, like an interval recurrence, we're not helping them understand all the things to look out for. So if patients are undereducated who have the most incentive to know this information, then the general public very much doesn't have the information that they need. So for Pillar 1, we have developed an online training course with materials and an online community platform where everybody can share best practices with each other around the world. So far, we've trained over 1,000 volunteer educators through this course in 65 countries. And I want to share with you Jumatil's story as a video. So Jumatil is our volunteer educator in Indonesia. Very conservative culture, which is fantastic because Know Your Lemons can go into any corner of Indonesia and talk about breast cancer with people.
Jadi kami ini mengajarkan kepada wanita agar dia tahu tentang dirinya. Kami ingin melakukan empowerment, pemberdayaan, ya, agar wanita itu berani bicara dengan dokternya. Saya ingin menjadi edukator dari Know Your Lemon ini karena saya melihat bahan-bahan ajar daripada Know Your Lemon ini sangat mudah untuk bisa diajarkan kepada masyarakat umum. Jadi saya ingin agar semua wanita di Indonesia ini dapat mengenali 12 tanda kanker payudara ini sehingga mereka bisa melakukan pemeriksaan lebih lanjut yang mereka perlukan.
So there you can see he is able to go into schools, boys and girls, sitting together, talking about breast health, and then everyone is given a Know Your Lemons postcard in their own language with the assignment to go home and start the conversation with their families so that everybody understands what these symptoms are. For Pillar 2, we have created an early detection app that helps people identify symptoms and navigate into screening. Currently, the app is in 4 languages. We're expanding to more, as well as more countries, because we want to be able to give people specific screening information for the geography that they are in. The app works for any gender, and it teaches a number of things. So here you can see this one talks about symptoms. If people think they have a particular symptom, they can look it up, read a description, and say, oh, that fits me. And then they can tap a button saying, I think I might have this. And then it will say, okay, what do you want to do next? Because this is the decision moment where patients can say, I'm just going to go into denial and kind of freeze and not do anything. So we say, okay, here are some options. One option is, if this doesn't seem like it's that concerning to you, you're just like, that seemed a little different. You can set a reminder to remind you in 30 days and ask you, is this still there? Is this persisting? Another option is to call a friend. Sometimes we just need to vocalize something outside of ourselves and share it with somebody else. And that can have that friend say, you know what, I think you should just go get it looked out, or I'll go with you to the doctor, or that sort of thing. They just need some social support to help them make that next decision. The one that we emphasize is talking to your doctor. And then we have a guide that explains, here is the information that your doctor is going to need to know. So be thinking about these things in advance. And then depending on where in the world they live, what they can expect next. So in countries that have screening programs, we say you should expect a mammogram at the very least at the end of this appointment. We have a number of patients that have said to us, I saw the symptom, I went into my doctor, and my doctor said, you're too young, or let's wait to see if it gets worse first. And they said, but because I'd seen the image, I had confidence that what I had was something that needed investigating. So they insisted on testing, and that's how they were diagnosed early, because they knew how to advocate for themselves. And then we also have self-exam guides. We have Mona Lisa that teaches how to do self-exam. We also have Napoleon that teaches how to do a chest exam for men, people who've had top surgery or mastectomies. And then we also have a screening tool. This is different from like the Tyre-Cuzick model or the Gale model. The questions are very similar, but what we're asking is, do you have any particular risk factor that would trigger a change in your screening plan? And that is with the American Cancer Society screening recommendations. In the UK, it's with the NHS screening recommendations based on different risk factors. We know a lot of GPs do not know what screening plan people should be on for particular risk factors. So what this app does is after that questionnaire says, this is the suggested screening plan according to recommendations, bring this along with a bullet point list that the app has to your doctor that says, these are the particular risk factors you have, and decide on your screening plan together. So you have an educated patient coming in with recommendations saying, do you think these recommendations apply to me? The third pillar is a diagnosis toolkit for treatment navigation. And this is to help patients at the moment of diagnosis. It's a very overwhelming time. It's very emotional. And you just don't know what's going to happen next as a patient. It's a lot of unknowns. So the Dandelion Toolkit really easily explains the treatment options. I'm going to do a really quick demo for you of what this toolkit looks like. Danny, could you hold the microphone? So it comes in this box. And inside are two things. This first one is a conversation card. And on a single piece of paper, you can explain everything the patient needs to know about their diagnosis. And it uses this visual of a dandelion in different stages to explain staging. And you can see stage 4 is when the seeds have blown away. On the back of this card is the surgical information, and it's just ticking the boxes, checking off the boxes, and filling in details. And then on the back, the top is pathology, and it uses the metaphor of a dandelion seed to explain what ER positive or HER2 positive breast cancer is and how those are connected to different treatment options. And then finally, thank you, the bottom shows dandelions in grass, and each way you try to get rid of a weed in the grass are the same approaches to treating cancer. So chemotherapy would be like putting a chemical over the whole lawn, and that's going to impact anything fast growing. So that's going to be the grass, which is the body, and the cancer, which is the weed, right? Targeted therapy is going to be putting a chemical over the whole lawn, but it's mostly going to be impacting the dandelions. Hormone therapy is putting a chemical over the whole lawn that's going to kind of trap those seeds in place. And then you've got surgery, which is digging it out. You've got radiation, which is using a magnifying glass to like specifically use rays on a certain part of the lawn. And then you've got immunotherapy, which is using the grass to choke out the weeds. So by explaining to patients, here are the 6 treatment options, and this is why we are picking these 3 for you because of the particular way your breast cancer is, then that really helps them understand, oh, this is why I'm being given this treatment. So often patients don't know the why behind it, and it makes it really difficult for patients to be adherent to treatment options when they don't understand why they're given something. And then so they take that piece of paper home with them, and they have this notebook that explains all of it in detail, and they take information from that piece of paper and they transfer it onto this notebook, and then they bring it back to their next appointment and they fill out the blank spaces together. Because what we have found, especially with cancer being so multidisciplinary, is that nobody knows who's saying what to the patient, and the patient's in charge of managing all that information, but the patient usually hasn't been through breast cancer before. So they don't know what they don't know. They don't know what's been told to them. They don't know no one's talked to them about fertility before treatment started, right? So they will see in here, there's a blank space with fertility question mark. Oh, I'm gonna bring up fertility next time when I go into my discussions. So that's how that visual navigates. So after developing all these materials, we had many organizations coming to us saying, we love that picture, can we use it? We'd like to be able to train volunteers to go out and educate. And we said, well, we have all these tools, so we came up with a really easy way for people to partner with us so that they can use all of these resources. They can use the training course, they can use the materials, we translate, we work with them to make sure that they have all the resources that they need. The impact that we've made so far, we started this partnership program this year officially. We now have 84 members as part of the World Breast Alliance that reach 2 million people in person collectively. And with the social media and digital reach, we have 5.4 million. So it's really exciting to be here at the World Cancer Congress because we're like, there's so many more organizations that are out there doing good work with breast cancer, and they don't need to make a new campaign. We just want you to use our things. It doesn't cost anything. We provide the training for free. We just want you to be able to go out and share this with the people that you serve. So we have educational tools in over 40 languages, the training course, the navigation toolkits, online community platform, and then quarterly workshops where we talk about each of the pillars together. And then this is a map of our impact. So these dots are our partners. And then the pink dots are where our volunteers are located that have been trained. And then the green dots represent how many people have been taught. We actually have a live map. So as soon as somebody teaches, they report in through an online form. This is where I was located. Here's where I taught. Here's how many people. They often send in photos. This is where all these photos have come from today. And we're able to map out in real time where education is taking place, where the blank spots are, so that we can look at new partners or finding new ways of educating. These are our Alliance members, and a special thank you to Daiichi Sankyo in helping fund this. All right, now I'll turn it to Irene to introduce the panel.
We have Dr. Hadi coming from Qatar Cancer Society. Gisu Dakotas from Daiichi Sankyo. Dr. Aisha. And from Zanzibar Outreach Program, we have Dr. Amina Amada, Dr. Bilkis, and Dr. Naila. We are so excited to hear from you about all of the amazing work you've been doing and how you're using the resources out in the field.
All right, wonderful. Thank you for being on the panel and talking about it. It's one thing for me to say we're great, but it's another to hear about the experiences of how people have been able to use this in their organizations. So Dr. Naila, how did you find Know Your Lemons?
Thank you so much. My name is Dr. Naila. I'm from Zanzibar Outreach Program from Tanzania. Currently I'm a pathology resident, going year 2. So I came here in 2022, UICC. We were moving around looking for which session to attend, and we found the lemon. We saw the lemons on the screen because the door was open. So it attracted us. We were like, let's just pop in. And then when we popped in, we listened, me and my senior, Dr. Naufel, and then we liked it. We liked the idea. It was very interesting. And we were like, you know what? Let's just join the force and see how it works. Since we're coming from Zanzibar, and it's like 98% are Muslims, you know, it's very hard to face women and tell them about breast. And so, yeah, we used the lemons. I firstly took the training. I learned I'm a doctor, but there were things that I didn't know. And you know, we study in English, but to explain some things in my language, which is Swahili, it's a bit hard. So with the lemons, it was very easy for me to tell them. The seed, it's supposed to be like this. If you see the green peas, it's supposed to be like this. Is the lump going, coming, or is it stable, growing after some time? So it was very easy. I gained so much. As a doctor, I didn't know myself. So I encouraged my fellow volunteers to do the lessons. We got our certificates and we became Lemonistas. I'm proud of that. From then, from then, wherever we go, we take our lemons with us. That's what I'm saying. Every time wherever we go, we take our lemons. So what we do usually most is outreach programs. Not everyone has an access to reach to the hospital. Not everyone has a awareness of breast cancer. So why not just follow them and tell them? We might not have the facilities to do the screening, the mammogram, but if you know your body, you can spot the changes. Yes. But how do you know your bodies? Just do breast self-examination, because I was ahead of breast self-examination. And from then, we diagnosed about 12 patients after Know Your Lemon. So they used it, and they downloaded the application, and more of our volunteers, they, you know, I can speak the whole day about Know Your Lemon because it's perfect. But it helped. And when the green lemon came, it was like perfect, and it was in Swahili. Because, you know, some of the sign cannot be seen if your skin is colored, you know. So it would be like, it's hard, I cannot see the redness. But when the green came in, I was like, now you don't have any excuse, you have this. This is the green lemon, and it's in Swahili. So I was so happy with this. Words are easy. Now I'm like, you see, look, I don't even have to use my breast to show you. Because also we train our champions, our survivors, we call them champions, because they are champions. We use them whenever we go to give the word, you know, they can tell the people, I had cancer and I survived. So they get to be believed easily. So we train them, and they train the people, the society before screening. So it's just a great job. Perfect. Thank you.
Thank you. All right, Dr. Amina, and there's some microphones on that table for you too. Tell us about the training that you do with Know Your Lemons.
Good afternoon, everyone. My name is Dr. Amina Idris Ahmada. I'm a medical doctor, and now I'm doing a master's in Ops and Gyn. So I did the Know Your Lemons training recently. I just knew about breast cancer in theory-wise school. As Corinne once said, it was, of course, it's school, it's boring, okay? And okay, for me, I'm a doctor, so it was something that I had to do. But when it comes to the part for my patients, it was a little bit difficult to explain things to them, especially when it comes to tell them in a very easy and simplified language that they will be able to understand. But after taking the training, I was like, I needed this from the first year of medicine. So I started using that, and I started with my family. With my experience, I had a leaflet in my car, and it's like drawn, the breasts were drawn. And so everyone who enters my car is like, why you are putting these things in, you carry children, this is not good. You know, for us, our cultural aspects is not normal. Religious and all that is not supposed to be that way. So I started hanging this, and anyone who enters my car, they're like, "What's this?" I'm like, "Okay, I need this." I'll explain, and they'll just, when they see me some other time, they'll be, "Explain this to this." Or they will be like, "I need that. I need to explain it to my coworkers or to my children and all that." So that helped a lot. It was easy for me to teach people in a simplified and easy, understandable way. And from those people I taught, they were like my ambassadors. They will go beyond and tell others. So we took more leaflets and provide, and others, I think Dr. Bilkis will explain about um, the programs we have with ZOP, Zanzibar Outreach Program.
That's great. Thank
Thank
you.
you.
Yeah,
Thank you.
that leads us on to the next thing about that. So, Dr. Bilkis, you modified the program for teenagers. So, tell us how this idea began and what you've done so far with your teen program.
Okay, hello. My name is Dr. Bilkis. I'm a resident in year 2 in internal medicine, hopefully gonna specialize in oncology. So yeah, from ZOP, Zanzibar Outreach Program, we carried out several outreach programs, the awareness campaign for the breast cancer, and sometimes for the cervical screening also. But we realized that it was successful, but although it was successful, most of the ones that come for analysis were the adults, not the young people or the young adults or the teenagers. They're mostly the elder people. So that's why we realized that we need to do something for the young adults too. So we have this internship program in our organization whereby the high school students, the one that finishes the high school, have a time before they join the college, the waiting time. So they come to the organization and they opt to do volunteering work. So this time we said, why not? Why shouldn't they be trained as lemonistas and try to carry out their work, become the ambassadors for the Know Your Lemons, so that they can be able to teach their fellow teens in schools. So that's when we started teaching them, training for trainers, and they completed the course. They become certified lemonistas, and one of the teachers was Dr. Naila also. So yeah, they were sent to schools under supervision of the doctors and the senior lemonistas, and they gave out the knowledge, the awareness to the students, and this has it brought a lot of impact, lots of benefit to the society, because we give them flyers. So those flyers, these leaflets, were sent to the people, to their homes, to their mothers, sisters. So it reached out easily to the other members of the family. But it also brought awareness to the youngsters. So as they grow up, they will realize that breast cancer is there, and they should know. They will be knowing the symptoms already. And also, it made the young people feel more secure and more comfortable to explain it to themselves and to others. So it benefited a lot in our society. Thank you.
How many did you train?
Lots of children. Because we collaborate with the Ministry of Health and Ministry of Education in our country, so we easily go into the schools, whether public or government schools. So we reach out to many students, and we get students that they complain that, at first I didn't know that this was a symptom, and I couldn't speak out because I was too shy. But I can easily explain myself right now. I can explain it to my teen, the one that went to explain it to them, and also take it more further up to the doctors, to the seniors. So yeah, it was a good thing. Know Your Lemons have done the best.
Thank you. And something to add to that is that as the teenagers were teaching the other teenagers, one of the girls had noticed a change in her breast for several months and wasn't saying anything to anyone, but then she brought it up to one of the teenagers that was there, and they encouraged her, and now she's going through the diagnostic process right now. That's incredible. Thank you so much. Professor Aisha, tell us about the research that you did with the campaign in Malaysia.
Yeah, I think the first thing that triggered all the research was a previous research that found that health literacy was the reason for advanced presentation. And somehow we forget it. And because you have done such a great job a PhD on symptoms. And when I first saw it in Burma, this was something like 2017. That was when it triggered. This is wonderful. Yeah, so wonderful. So we collectively did research between 2017 to 2020, and we surveyed about 800 women in the community. And we found that really it improved the literacy, health literacy on breast symptoms. And actually more than 90%, 93% of them agreed that they knew what tests that were required after the detection of a symptom. And I think that really drew me into this, your tool. So then now we are putting in the tools in everything that we do. So we are doing implementation research, creating creating an early diagnosis ecosystem in an integrated approach of different types of cancers. So guess whose tools we are using for breast cancer? So essentially, Know Your Lemons. So we actually put it into our nursing competency program for increasing clinical breast examination. It's on the 3rd year running this year. So the first year we did only breast cancer, and we only did it in the pilot primary care clinic. We trained about 9 people. The next year we decided, okay, not enough. We have to put cervical cancer in. So the second year was cervical cancer. And this year we have about 30 trainers where we added on even for colorectal cancer. Because the community nurses, they are the first contact. The screenings happen in the clinics. The symptom detection is in the clinics. But if the nurses do not know and comfortable and happy and confident to say, go and get your colonoscopy or go and get your mammogram done. So therefore, I think your tool is actually sitting in the clinic, the pilot clinic, and it helps people navigate within the clinic. Yes, so they actually announce, oh, there's screening here, you can have clinical breast examinations. So from your tools and from the co-creation of the pathway in the clinics, the uptake of clinical breast examination increased in the target population of women above 50 from 5% to 15%. It's nothing much, yes, it's nothing much, but this is a pilot. So the other training program we have is for GPs. So GPs are also given an integrated approach to cancer screening, because right now it's almost like if I want to learn about breast cancer, I have to go and call me the breast surgeon. I'm a breast surgeon by profession. And when we do colorectal, we call someone else. But we integrate everything into the program. And guess whose tool is in that program? They have access to your website, so they can also use those materials in the clinics. So I would say it's been a fantastic journey. We even have a MOA with you, with the university, and we will continue to use your tools because we are embarking on the next phase of rollout, where we will be exiting into the City Cancer Challenge, where we're looking into health system coordination, and of course, training, increasing literacy. So we have the GP program. We also have a lay navigator program that we use. Actually, you can watch our YouTube channel. It's called Rebung, R-E-B-U-N-G. It's in Malay. It means bamboo shoots. Because bamboo shoots, if you shape them when they're young, they become the shape you want. And eventually, they become strong bamboo, the most strongest biomaterial, right? So we're looking forward to using the materials, continuing to use it, because we believe that this is something, as what our ladies here say, you reach the community instantly, gives them confidence, there's no stigma. You use it in mosques, churches, Buddhist temples, you can use it anywhere. I think that's all. Corey.
Thank you so much. And it's been, as she says, co-develop, right? So we say, how is this working? Let's look at different ways of using it within the system. And this is why partnership is so important, is having that locality, that perspective of how can we adapt it. Thank you so much. All right. Dr. Hadi, tell us about how this is working for you in the Middle East.
So thank you so much for having me here today. So I'm just going to give you a little history how we came through Know Your Lemon and the tool. It will go back to 2017. We opened the first cancer education center in the region that it's away from the hospital. And as we were thinking of how we prepare the education center. We want to bring people, or either in the center or outreach. We want interactive tools. Then we start to look model for breast cancer. When we start to look online, those model of the breast, it will not work out at all in our region. I mean, you can't. And so, and then we looked into, companies that they provide educational material for health, and it's all of it did not work out. Either it's not practical or it doesn't, fit our culture. And then, we came across online. Before even we came on the Know Your Lemon, and we start applying it, and it's in our educational material, and it really made a lot of initially made a lot of difference. And I will tell you, we have some modification to it also for our contest, but it made so I'll go from the school age. School age education, we have a school program. We have per academic year around 4,000 students go through our education program in our center through agreement with the Ministry of Education. So the brochure, this tool, it's embedded within our tool. We took the tool, we embedded in our educational tool, and it really make a lot of difference in education. We flip the page that has, last page of the brochure has this tool, and the Know Your Lemon, and we just explain on it, and we can comfortably explain to it anywhere. I mean, the school, male, female, no issues in the school age. And they can take it home to their parents, and without any being smacked around what you have in your hand, what you are bringing home. And so that's at the school age. And regarding in our workshop, even like, so I remember I gave that workshop. It was in a mall in Doha in Ramadan after iftar, and we're doing a 10th educational health seriously. And Ramadan, and you just and then I used this tool, and then a man came forward, and he told me, by the way, this looks, my mom, his older mom is like in the mid-50s. She has the same symptoms that you explained to us. And then I told him, you need to take your mom to be checked out, and so on. So that's how much it's made it easier. And then later on, we added a layer. So we work with the 3D printing companies. So we added a layer on top of the design that when the person touch it, it gives you the feeling. It gives you the feeling of the actual. So this is but this is the cost of a brochure like this, and it's it's not cheap, but it's a very good tool that people take it handy. They take it home. So that's my tool. But I don't know. Are we going to talk about the treatment guidance later on? Because this is another point I really want to comment on it on the dandelion.
Yes, after we hear from Gisu, that would be fantastic.
Good, excellent. But that's because thank you so much.
Yes, thank you. So now we've heard about how it's working in Africa, how it's working in Asia, how it's working in the Middle East. Gisu, you are global with Daiichi Sankyo, and you're seeing all the efforts that are happening around the world. Tell us about how you see the importance of education for early detection in terms of the overall breast cancer picture.
Sure. Thank you, Corinne. First, I want to tell you how I found you.
I want to hear this.
The origin story is I was at ESMO. This was a long time ago. And I was taking a train to the conference. And I looked up, and there was a wall with your green lemons. And I thought, we didn't have a product on the market at the time. I said, this is really easy to understand and such a wonderful thing to share, because there's a health literacy everywhere around the world. So even in the US, health literacy is big. So I said, I'm going to call this lady. I didn't know if it was a lady. There was a number. I said, I'm going to track you down, and I did online. I sent her an email, or I think it was a LinkedIn, and I said, I really would like to speak to you about this. And it was really weird, because I was stalking her for a while. But then we met, and the whole process has been really wonderful to get to know the organization. And I think the name was different at the time. When I first met you, it was World Breast Cancer Organization, I think, yeah. and then the name changed, which is a much better thing. And the focus of the organization is always on the patients, which is important to me, because I do look at it from a global aspect. And I mean, we have several languages in Europe that has been very helpful to bring in this education in a way that is understandable by everyone. Every year we have an employee event where we have Know Your Lemon come and talk to our employees. And there were several men that talked to me and they said, "Ooh, we found it on our wives." So I said, "That's good." So it works for both and it's really wonderful. So what was the real question? I'm sorry.
No, that worked. That answered it really well.
Okay.
So we've got 10 minutes left. I want to make sure that there's time for people to ask questions as part of that, and also make sure you have time to collect things from the table before you go. We've got stickers and handouts and all sorts of things. I do have a couple dandelion toolkits with me as well. And in particular is this last screen of how you can join. So you can scan the QR code and fill out the information on the website to start that conversation. We also have this black card that has a QR code for you to take with you that takes you to the same link. All right, so any questions? Yes.
Okay, thank you very much. So my name is Phoebe Ongadi from Kenya Network of Cancer Organization, and I'm already seeing myself giving a testimony next time. Yay! And I was very happy. There's a photo there that a lady was talking and there's a gentleman who was really looking. And I'm like, wow, this is the next big thing. So I'm just here to encourage you. We are a patient advocacy from Kenya, and this is our cup of coffee. When I was in Kenya, it was tea. Now it's coffee. So this is what we do every day. So congratulations, and I can't wait to scan and just to join you and to spread the Know Your Lemon. And I was so excited when I saw it in Kiswahili. I kept smiling. When you come to East Africa, they beat us in Kiswahili. But the one I saw there was fantastic. So I'm just very happy, and she knows it.
Thanks. Prof. Aisha, can you tell us, you have done just an incredible job in Malaysia of coordinating all of the NGOs and bringing them together. Along with the nurses, we have a cohort of 600 nurses that are going through our training program, 600 nurses that are going to go out in the country and educate. And it's just been really fascinating to watch how you bring all of these groups together, all of the different stakeholders in the country. Can you tell us how you do it?
I think it's just trying to
That's Aisha's
see.
secret.
Oh, that's trade secret. I think it's more of trying to look at the end first, because I think we try to work out little things, but somehow we don't see the big picture. But I suppose it's just because I'm a surgeon. I work with patients. I talk to patients, and I always listen to them, and I get feedback from them. I listen to the nurses, and the nurses have major roles. So we brought breast care nursing into my hospital in 2005. It was a game changer. And what about the community nurses? They are not supported in any way. They're not trained in any way. So we thought, okay, the first thing, we must strengthen the health system. So that was part one of the pilot, which is called Rebung, the Rebung project, reducing barriers in cancer early diagnosis among urban B40 group. So that's the Rebung project. And of course, now that we just had that meeting this morning, I've introduced you to the powerhouses in Malaysia. So we have breast cancers NGOs that have been there since the 80s. They're very strong NGOs. They have structure. So if we work together, and I think there's something like 20 over breast cancer NGOs across Malaysia, and if they can work together and really look and see what their roles are. I think at the end of the day, we have to think about sustainability. We need to think about our natural roles. What do we do best? So in the university, I come from the university, of course we do research, but most of the time we do a lot of training. So when we exit the Rebung project, a lot of the things that we learn from the care pathways that we've co-created with Ministry of Health, will of course go to Ministry of Health. But the training that is required can be actually done by us in the university.
So I think we all need to think about our roles, and maybe we just must have that cup of coffee one day with your friends and see how everybody can work together. So I think there's no magic to it. I think it's just about thinking about the patient first. Think about the patient, be patient-centered, think about what they need, and then you will see that everything comes true. I think maybe that's how I did it. Just a little bit.
Yes, she's quite remarkable in what she's done in Malaysia, and we're so excited to continue to keep doing more things there. Definitely. Dr. Hadi, please.
So regarding the dandelion, this is something in the GCC. I think all over the world, missing the patient-centered patient navigation. So an understanding. I mean, okay. So I'll tell you. In Qatar, patient when they finish, they give them when they decide on treatment, they give them a complete document signed by the doctor, the nurse, explain to them this is your treatment plan. Yes, it's written in a language, easy kind of thing, but we're talking, you need something visual. This is very stressful journey. They need to understand. And I really liked the design on how you explain the immunotherapy, the hormonal therapy, and all the aspects of radiotherapy. It's like a friendly, easy to understand checklist that the patient can hold on it. Whenever they go back to the patient, they can the healthcare provider, they can discuss it again. And here I'm going to share example, not because I'm not experienced there. I'm going to share example from my previous research. It's in pediatric cardiology. So one of the people that I interviewed in that research shocked me. I told him, so tell me, I mean, I know the diagnosis, but I want of his child, but I want to understand the father. Does he understand the diagnosis? And he told me, wait, doctor. He pulled plastic has a Ziploc, has a napkins or a piece of paper. The surgeon drew the diagnosis on it. So the father holding on that picture, because that where he understood the diagnosis of and that's the importance of the picture. And so something that when the patient get involved in empowered in understanding their treatment plan, or it's not just a A4 letter written in Times New Roman font size 11 because they want to, yes, yeah, or they want to, I mean, it's that way is really, it's going to make a difference. I've didn't try it, but definitely in Qatar Cancer Society, we're going to work on having it distributed to all breast cancer patients, that they come whenever they get diagnosed, come over to us. This is whenever, so we in addition, we do psychosocial support and also financial support for people that cannot afford covering treatment. So per year, I mean, we have around 400 breast cancer patients. They continue their treatment. So this is something very important for them to gear the discussion.
I think we're blessed to have Corinne, isn't it? Thank God she decided to do design for breast cancer. No, really.
The thing I love about I've always loved it, but it's the co-creation, not just with patients, but with physicians and nurses, and really creating something that resonates with patients, right? That's the part that I love, because you don't have to know anything. You can read it and pictures and get it, which is really wonderful. And the co-creation is really important because patients have put their input in it, and it meets their requirements. So that's wonderful.
Thank you. Yes, in fact, the Dandelion Toolkit took 9 years to develop. Wow. And and breast cancer treatment kept changing, so we had to keep updating things. When this started out, immunotherapy really wasn't in the breast cancer space. And now we have HER2 low and all of that stuff. But so it will continue to adapt and evolve as it comes along. So I wanted to thank our panel so much for being here today. Oh, yes, of course.
Sorry, a closing sentence for us. Now in ZOP we have this word for know your lemons, to know that you're doing a good job. As we said, we started with an ulcer, now we have a lump. So yes, because they will come with an ulcer, But since now they have an education, it means now they come with a lump. Yes, the stage is lowered. Instead of stage 4, now it's stage 1. Good job.
Thank you. That's definitely worth saying. So thank you for saying that. Yeah, so she's saying this is the ulcer, which is stage 4, and this is typically when people were coming to them, and now they're coming to them with this. Thank you, and then a special thanks to Daiichi Sankyo for sponsoring this session and giving us this moment to share with everyone. Thank you so much for your support and championing women's health for breast cancer. We really appreciate that. And finally, please come up and grab things to take home and share with family and friends, and come up and talk to us as well. If you're interested in a Dandelion Toolkit, come talk to me.
Nice job. Congratulations.
Nice to meet you. Thank you.
Congratulations.